Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer for Public Health on Call. Today, Dr. Josh Sharfstein welcomes a special guest, the Assistant Secretary for Health, Admiral Rachel Levine. They discuss the role of the Assistant Secretary, key priorities for her work, and what it's like to be the first transgender four-star admiral in all of the uniformed services. Let's listen.
It is my absolute pleasure to welcome the Assistant Secretary for Health of the Department of Health and Human Services, Admiral Dr. Rachel Levine, to Public Health on Call. Thank you so much for joining me.
Well, thank you. It's a pleasure to be here.
So before we get into the job you do for the federal government, I just wanted to ask you to introduce yourself to our listeners.
Well, thank you. So I'm Admiral Rachel Levine. So I am a four-star admiral for the Public Health Service Commissioned Corps, and that is absolutely an honor and a privilege. I'm also the Assistant Secretary for Health at the Department of Health and Human Services, and have the pleasure and privilege of serving under Secretary Becerra. And, we concentrate on medical and public health issues, and I'm the principal advisor to the Secretary. Previously, I was the Physician General and Secretary of Health of Pennsylvania. And in a different life, I did pediatrics and adolescent medicine in academic medicine at the Penn State College of Medicine.
Let's talk about these really important jobs that you have right now in the federal government. And I'd like to start with the Assistant Secretary for Health part of your job, but then I want to get to the Admiral part of your job. So the Assistant Secretary for Health's office is pretty broad. It has a lot of different components.
It does. And actually, the Secretary's office has called us the connective tissue of HHS. And I take that as a compliment. So we are involved with all of the different priorities of HHS. And we work as a convener. We work to help the Secretary in terms of the collaboration among the different operating divisions and staff divisions of HHS, and its coordination and communication on the health priorities that we're facing, which include, of course, COVID-19, health equity, mental health, and substance use, among many others.
So let's take an example. On COVID-19, we know that FDA is reviewing applications and just making, the authorization decisions for drugs and devices, and CDC is out there giving guidance to the federal government. What's the role of the Assistant Secretary for Health?
Well, the role is really to help with the coordination of all of those different pieces. It is critically important for us within HHS to be coordinated, but also for us to collaborate with state and local health officials. And so I have actually a weekly call with the White House with state and local health officials, among other public health experts, the CSPE, epidemiology, APHL for laboratory, where we work to make sure that we have this coordinated response across the nation to COVID-19.
And I imagine that coordination goes in both directions. So you are feeding back to agencies like FDA and CDC what you're hearing from some of your former colleagues in states across the country.
That is correct. We have regular phone calls across the agency where I'm able to discuss what I am hearing from, for example, ASTO, the Association of State and Territorial Health Officials, or NACHO, the local and health officials and big cities, etc. And we work to coordinate our response across the country.
And what are the big issues that you're hearing about from the state and local level on the pandemic about now?
Well, I think that the pandemic has emphasized the critical importance of public health like no other issue in 102 years. And it is just so important that we all work together. So, we have discussed the full gamut of issues that impact our response to COVID-19. We have talked about testing and challenges that state and local health departments might have with testing or with contact tracing, with implementation of basic mitigation measures such as wearing masks and social distancing, and then finally, coordinating the distribution and administration of our safe and effective vaccines.
That seems like a lot of work on its own, but you also are thinking about other challenges facing the country.
We certainly do. One of the Secretary's absolute priorities is health equity. COVID-19 has also shown the depth and breadth of the health disparities that we have in our nation, particularly for historically underserved communities, the African American community, the Latinx community, the American Indian, Native, Alaskan community, among others. So I am very proud to co-chair the Health Disparities Council with the Assistant Secretary for Planning and Evaluation for the Secretary to address those. I also have a seat on the COVID-19 Health Equity Task Force. So we're really looking to address those health disparities and prevent them in the future.
I've been reading that some of those disparities have been getting smaller, particularly in vaccine access over the course of 2021.
Well, they have improved, but we have a long way to go. But we have made progress with vaccine access as well as other aspects of COVID-19. But we need to go beyond COVID-19 to the health disparities that exist really on a range of significant public health issues.
Absolutely. Let me turn to another issue that you mentioned, which is mental health and substance use. What are the key issues facing the federal government? How do you and your office fit in?
Well, so I am, again, proud to co-chair the Behavioral Health Coordinating Committee for the Secretary with the Assistant Secretary for Mental Health and Substance Use, Assistant Secretary Delphin Rittman. And we are working on a whole range of issues, including pediatric mental health issues, the integration of physical health issues and mental health issues, and particularly the overdose crisis, which not only continues, but has been exacerbated during COVID-19.
Yeah. What are some of the key priorities for reducing the number of overdoses right now?
Well, we actually just released an overdose strategy yesterday, and the Secretary and the Assistant Secretary for SAMHSA were together in Baltimore, actually discussing that. We have 4 pillars to that strategy. The first is prevention. We want to work to prevent substance use disorder and overdoses. That includes prevention efforts with healthcare professionals about the careful and judicious prescription of opioids, but as well as prevention efforts in schools and in the community. The second is harm reduction, thought of very broadly. Harm reduction includes syringe service programs, which we're strongly working for and advocating for, as well as the continued distribution of the life-saving medicine naloxone. And finally, acceptance for and distribution of fentanyl strips, since we know how dangerous these fentanyl-related compounds are. The third pillar is treatment. We need to get more and more people into treatment, particularly medication for opioid use disorder, as well as other treatment options, since it's not only opioids that we're seeing. We're also seeing increases in overdoses and overdose deaths from methamphetamine and cocaine, et cetera. And then finally, working to get people into recovery. So those are the 4 pillars of our strategy.
Fantastic, and tremendous amount of work lies ahead, obviously, in those areas. I want to switch gears and ask you about the Admiral part of your job, because in addition to all these roles on these critical health issues facing the country, you are leading the Commissioned Corps. So if you could talk a little bit about what it means to be an admiral, what is the Commissioned Corps, and what the future role is of the Commissioned Corps in these challenges facing the country.
Well, thank you so much. So I have had the absolute honor to be commissioned and sworn in as a 4-star admiral for the United States Public Health Service Commissioned Corps, which is a group of 6,000 actually Commissioned Corps officers that serve throughout the United States for medical and public health issues. We have these are a group of outstanding medical professionals, including physicians, nurses, nurse practitioners, physicians assistants, pharmacists, dentists, and many more, who work at such agencies as the Indian Health Service. They work for the Federal Bureau of Prisons, seeing patients, but they also serve at the CDC, at the NIH, at the FDA, and many other agencies. They also are often detailed to deal with public health emergencies. And during COVID-19, public health service officers have gone on more deployments than ever before for COVID-19, to deal with health issues at the border, and also to deal with health emergencies associated with climate change weather events, such as hurricanes and floods. So it is just truly an honor to lead those group of dedicated officers.
Not too many people realize there literally is a public health army that can be used to save lives in this country.
That is absolutely correct, and I am so pleased to work very collaboratively with Vice Admiral Vivek Murthy, our Surgeon General, who deals and works on the operational aspects of the Corps, and we work together to lead this group of dedicated officers. So, what is unique about being a four-star general? Well, so there are a little over 40 four-star officers in the 8 uniformed services. So, and that's an important distinction. I am a 4-star admiral in one of the uniformed services, the United States Public Health Service Commission Corps, and the other uniformed service like us is NOAA. But we're not actually in the armed services. We're not in the military. Traditionally, the military is the Army, the Navy, the Marines, the Air Force, etc. So there is a distinction, but it is just truly an honor and a privilege to serve.
Got it. So I should say 4-star admiral. That would be the right way to say it.
That is correct.
Great. Now, you also, in all of the uniformed services, including the military services, are the first 4-star transgender official. Is that right?
So that is correct. I am the first openly transgender individual to serve in the 4-star capacity. And, you know, again, it is an honor to serve and to be the first. Although, as Vice President Harris has said when she was sworn in, she may be the first, but she's convinced that she will not be the last. But I think that this is further demonstration of President Biden's commitment to equity, diversity, and inclusion, which includes the LGBTQI+ community.
It is really a remarkable breaking of barriers that you've accomplished, and I think also in being a Senate-confirmed official. What does that mean to you? How does it affect the way that you approach the job, realizing that you are really path-breaking?
To be honest with you, it's humbling. To be the first in the different designations that you talked about, and so I really work to bring humility to this position, but it's also very empowering, and so it's a combination of both. But you know, I have taken these positions to serve. You know, what I loved about my previous job, again, in academic medicine, was the ability to help people, whether that was through patient care or through education or clinical research or administration. And so now in public service and public health, what I'm trying to do is to serve and to help people with this broader public health perspective. And the opportunities that I've had as the Assistant Secretary for Health and as the Admiral for the Public Health Service Commission Corps really facilitate my ability to serve and help people.
Well, I'm sure you know, but I will certainly say you are making the field of public health very proud.
That's very kind of you. It means a lot. I really appreciate it.
So as we look to the next few years and, you know, hopefully the waning of the pandemic, but all of these challenges facing the country, any final words for our listeners in terms of, you know, what to expect from the department or from your office?
Well, you know, the challenges continue. And so as we work through and then eventually past the COVID-19 pandemic, we also have to face actually the public health issue of climate change. And one of the areas that I'm particularly energized to work on is with our new Office of Climate Change and Health Equity. We have seen that climate change is not an existential threat to the future. It's a threat to public health now, both in our nation and globally. And so we are working to address that with our public health lens. Now, I'm a positive and optimistic person, and I firmly believe that the future will look brighter with the efforts of all of us working together, both through our great nation and also globally on these and other public health issues.
Dr. Levine, it's been an honor to have you on the podcast.
Thank you very much. I really appreciate it.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holes Fernandez and Caroline Wong. Thank you for listening.